Hello and welcome to Brain Health Matters. I'm Kate Kunkel, and this week I'm delighted to be interviewing for the first time Dr. Nafisa Sekandari, a licensed clinical psychologist specializing in anxiety-based disorders. Since mental health issues, including anxiety and depression, are well-known risk factors for dementia, this could be a very important discussion. We know that medications prescribed for mental health issues have many serious side effects and generally don't solve the root of the problem. The medications themselves also can and do have serious side effects on the brain. So I'm excited for this interview with Dr. Sekandari as she shares her holistic and integrative approach to creating long-term control of anxiety without medication or long-term therapy. And we'll be right back.
Brain Health Matters is brought to you by The Musical Brain, Book 3 in the Healthy Brain series. Enjoy the fun and easy practices in this book to improve your memory, sharpen focus, and master your mind with the healing power of music. Available on Amazon everywhere.
Dr. Nafisa Sekandari is a licensed clinical psychologist and award-winning author whose mission is to make mental health accessible to the masses, regardless of where they live in the world. Dr. Sekandari specializes in anxiety-based disorders and through holistic and integrative interventions helps her patients and online course students create long-term control of their anxiety and OCD symptoms without medication or long-term therapy. Her recent book, Calm Within, Transform Anxiety Naturally with the 3-Step AIM program, was recently published and is available on Amazon.com and wherever books are sold. Thank you so much for joining us.
Thank you so much for having me.
So tell me a little bit about your history with anxiety. Most of us have a story that is very personal about why we get involved in this work.
Yes, of course. Everybody has that story of how they became passionate about something. But for me, I have a history, a personal and familial history with anxiety. And as I started to make my own connection, like I always saw various family members struggling with anxiety, but I never thought that I really struggled with it because not everybody looks the same, right? So everybody experiences anxiety differently. And so because mine looked different than what I was witnessing, I thought, okay, then I don't have it. But as I got older, I realized that definitely anxiety has been hindering me and standing in the way of my life in so many ways. And it wasn't until I became a mother that I started really being impacted by anxiety, the irrational thoughts and fears, the beliefs, the limited mindset. So all of that was impacting me. And this is around the time when I was actually working on my doctorate and trying to get my clinical psychology degree. And so what I noticed is that a lot of people are struggling with anxiety on some level because I see it as a spectrum disorder. And some people, if they're not falling on the extreme end, they might not get diagnosed, but they're still struggling because I've never been officially diagnosed. But I'm a very high functioning anxious person. I can cover it up really well, but it doesn't mean it's not impacting me. It's not holding me back in a lot of different ways. So what I noticed is a lot of my patients are struggling the same way. So they would come to me and they'd be like, I'm so overwhelmed, I'm so stressed, or my job is being affected, my relationships are being affected. But what they weren't realizing was that their anxiety and their irrational thoughts and beliefs were getting in the way of all of that. And so once we put it in the perspective, in the context of that, I'm not into like diagnosing necessarily. I'm not into focusing on the diagnosis so much as to figure out what the symptoms are. But looking at it through the lens of anxiety has helped me really be more efficient in my treatment and also in helping them get better and more in control of their lives.
I love that you brought out very early that we may not get clinical diagnoses. And I think that's important because people say, oh, well, you don't really have a problem, and who's ever told you that you have anxiety? Like, do we really need someone to tell us that we have anxiety?
Good point. Exactly.
So one of the things that I work a lot on because of my work with brain health is the gut-brain connection. And I want to hear your take on that with respect to anxiety.
Well, one of the reasons that I'm able to naturally help my patients and my students online get better with anxiety without medication or even being dependent on long-term therapy is because I really focus on the mind-body connection. I really focus on the gut-brain connection, and that when we are healthy, when we're taking care of our brain, when we're taking care of our gut, when we're focusing on healing our gut, then that's where the majority of our feel-good chemicals are. A lot of people assume that it's in our brain. Our brain definitely uses the feel-good chemicals, but the majority of it is released and held within our gut. And so when we are able to heal our gut and our gut microbiome is happy and healthy, then they're able to release those feel-good chemicals and we would have an abundance of it. But when we don't have that, then we are struggling because our brain gets stuck. I kind of like to see serotonin like the grease that greases the wheel. And so when we don't have enough serotonin in our gut, or it's not being released in our body, then our brain gets stuck and we get tunnel vision and we get stuck in our irrational thoughts and beliefs. And we're not feeling good. We're feeling more reactive. We're not feeling as calm and happy. And so focusing on taking care of our mind, taking care of our brain, which does so much for us on a daily basis, and then taking care of our gut because they're talking to each other constantly. It's a two-way street for them. The brain talks to the gut talks to the brain. And so it's really important that they're both healthy. And that taking care of that and focusing on healthy lifestyle, focusing on making sure that you're healthy in a lot of different ways, not just with your emotions, but mind, body, then you're going to be less reactive in your life. You're going to experience less anxiety in your life, and you're going to feel happier in general, regardless of what's happening outside of you.
Yeah, and these days we certainly have a lot of stuff that can affect how we're feeling, right? It's so easy to get overwhelmed if we let that stick with us. And I like that you said about the brain itself, because I think when we take away the stigma of mental illness and we make it more like this is a physical effect, just like so many other things. If our gut's not healthy and our brain's not healthy, our mind is not healthy. And I think, what do you think, that this takes away some of the stigma of having this looked after?
Well, looking at our brain and looking at our gut, it does remove the stigma, because now I'm not judging your personality. I'm not judging your character as a person. I'm not saying you're flawed and a flawed individual. If I'm seeing some of these symptoms, then I'm saying, okay, this is what's going on with you. Your gut needs to be balanced. Your brain needs to be healed. It's no different than if you're needing glasses. I'm not going to get mad at you or upset with you because you can't read. I would be like, okay, your vision seems to be impaired. Let's get you some glasses, or let's correct your vision, and then you'll be able to read. The same thing with anxiety or depression or any mental health issue. When we're looking at it in terms of brain health or gut health, then we do remove the stigma, because it's not about you being a bad person, you being a weak person, you not being able to be strong enough to withstand or be in more control of your emotions. You're really looking at it as a symptom, like you would if you, like we know, okay, if my nose is running, I'm coughing, my throat is sore, then maybe I have a cold, then I'm able to target my treatment effectively directly to taking care of the cold. We can do the same thing with mental health issues and brain health issues.
I love that. A lot of people say, oh, mental illness runs in my family. And what's that? Is that true, number one? And what's the genetic connection of anxiety?
I think it's definitely genetic, but I think all of us experience anxiety at some point in our lives. Some of us are more disposed than others. Like I said, it definitely runs deep in my family. I can now, the more I know about anxiety, the more I can easily pinpoint all the different family members that have it. But I'm also of the belief that genetic loads the gun, but lifestyle pulls the trigger, right? So you might be predisposed to anxiety, but your lifestyle is going to make it worse. Like when I look back on my own life, I might have been predisposed to anxiety, but when I felt overwhelmed and not in control of my life and felt stressed and not balanced, I wasn't eating well, I wasn't sleeping well. Obviously, being a new mother, I wasn't sleeping well, and I probably wasn't eating as well as I should have. So that's when it really overwhelmed me and took over my life, even though it was affecting me before. And when it was affecting me the most was in my 20s. And that's when I was a college student and I was eating really poorly, like a college student, just eating junk all the time. I wasn't taking care of myself. I was staying up all night. I wasn't going to bed when I was supposed to. And that's when my anxiety was the worst. So our lifestyle and the way we care for ourselves is going to determine how bad that genetic disposition shows up, or how it shows up for us if we're not taking care of ourselves.
It's like Alzheimer's. There's a gene for it, but generally speaking, it's our lifestyle that determines whether it develops or not. Exactly the same.
Or cancer. I mean, our bodies are constantly dealing with cancer cells. We all have cancer cells in our bodies, but not all of us get cancer, right? And so it's our lifestyle that actually promotes that. We also have now understood that sugar, cancer cells love sugar. And so the more sugar we consume, the more we're feeding those cancer cells and the more they grow in our body. So it's just a matter of knowing these little things about ourselves so we can know how to hack our life.
Oh, I love that. Yes. Being self-aware, being mindful of what we're doing to ourselves and how we're functioning day to day. So in your notes to me, you said, become aware of the type of anxiety you have. I didn't realize that there were different kinds of anxiety.
Oh, there's so many. It's a huge umbrella. Anxiety is a big umbrella. And underneath that, you would have PTSD, panic disorder, social anxiety, separation anxiety, OCD. So there's all these different types of anxiety. And so for my patients to understand what kind they have, it really helps them understand, okay, how is this affecting me? It really doesn't matter as far as treatment goes, because I see that your brain gets stuck for similar reasons, which, like I said, lifestyle and not having the right nutrients for your brain and for your gut and your body, but understanding what it is. So for me personally, I didn't understand that I had social anxiety. Like, I didn't understand why it was so difficult for me to do anything, even with family gatherings, people that I cared about, people that I felt comfortable with. But the idea of actually going to an event was so overwhelming for me. And so understanding that really made a difference. Like, oh my gosh, that's what I was struggling with all this time. And then also obsessive compulsive disorder. That helps me put that in context, because when my brain gets stuck, it gets stuck on irrational thoughts and beliefs. I start focusing on things that really are not black and white thinking, basically, like not able to see the gray zones, because I'm either all good or all bad, and my brain getting stuck in that way. That really helped me put it in perspective as to, okay, this is what I'm dealing with. Again, I don't want to focus too much on the diagnosis necessarily, but understanding what that looks like, why your brain is getting stuck, makes a difference as far as like how to treat it and what to do about it. So when my brain gets stuck, or when I'm feeling overwhelmed and I'm not paying attention, I might start having black and white thinking or all or nothing thinking, where I might have an awesome day, an amazing experience, and all of a sudden one bad thing happens and the whole day is ruined. That's me having black or white thinking. I'm not able to see the gray in that. Wait a minute, I had a really good day. Everything was going well. This is just one thing. So that's me being mentally flexible, that I'm able to see the shades of gray. But when my brain is stuck and I'm getting tunnel vision, then I'm not able to see the bigger picture or problem solve either, because I'm only focused so much on the problem. I'm freaking out about the problem, that if I expand my tunnel vision, then I'm able to see the solution within that as well. So just knowing that my brain tends to do that is really important, because then I don't have to believe every thought that I have, because I have this little guy, his eye just popped out, his other eye just popped out, but I have this little guy. But basically, if I can look at him as him freaking out inside of me, or a little toddler inside of me freaking out and not being rational, then I can calm that little toddler down, or I could calm this little guy down, because I know that when he's freaking out, he's not thinking rationally. And I know that my rational brain is able to see the bigger picture and problem solve. But when I'm freaking out like a toddler would, you can't reason with somebody that's freaking out, right? So that the best thing you can do when somebody's freaking out is to calm them down. And that's what we need to do, is to calm ourselves down.
I like that idea very much, about being able to just identify it so you can recognize it. So then you know how to deal with it. I didn't realize until very recently that basically I have a tendency towards OCD. Like, everything has to be just, and I never really thought about it until, I don't know, I was talking to somebody about brain health, and she said, well, you have OCD. And I'm like, I do not. Wait a minute. Maybe I do, because I didn't think of that as a problem. It was just my way of being. I'm German. Of course, I'm going to be like that.
Well, I do want to say that there's so much stigma against all of this, right? But to me, I would say that having OCD is the best disorder that I can have, because there's a flip side of OCD. You would not be as successful as you are, as determined, as achievement oriented as you are, if you didn't have OCD. There are people that are very organized, very clean, When you can do that, when you're feeling in control and you choose to do that, that's not a problem. Society rewards you for all of that. Look at all the people that are OCD, that are very diligent, that are very achievement oriented. They make great students. They make great employees. They go above and beyond the call of duty. They're first in, last out. But what happens is, for those people, if they're not aware, the stress of that can make them feel out of control. That's what's going to make them feel overwhelmed, because it's not in control. It's like me giving you this beautiful horse that's like wild and untrained, but I keep telling you, no, it's the best gift I can give you. And you're like, no, how could you give this to me? This is awful. But if I say, train it, make it work for you, make it a racehorse champion, then you're going to feel really grateful for it. And that's how I feel about OCD, because once it's managed and controlled, it's a huge blessing.
Oh, thank you. So let's talk about stress and inflammation. Inflammation is a big deal for me too, in the brain health, like in the in Alzheimer's and dementia space. That's mostly where I work. So inflammation has, it's number one on the risk factors. Is that the same with anxiety?
So just with anxiety, with stress, with inflammation, the goal is not to eliminate that from our lives, right? Our body needs some level of inflammation. Our body needs some level of stress. Our body needs some level of anxiety. That's not my goal to say we don't need any of that in our lives. Let's get rid of it so we can be healthier. We need to have manageable levels. Inflammation, when it's out of control, can destroy our body from within. And so we want to focus on things that are causing inflammation. Just like with anxiety, we need to know what is the root cause, what's making our anxiety worse, what is exacerbating our symptoms. The same thing with why am I so stressed and overwhelmed right now? Why do I feel like I'm not in control of my life? How can I manage that stress? The same thing with inflammation. Why am my body's feeling inflamed? I'm feeling my joints are stiffening up. I'm not feeling like I can sleep. I'm not taking care of myself. So my body feels more inflamed. I'm more puffy. So all of those things that we need to pay attention to, because they're indicators. They're communicating with us constantly on a regular basis. So when we go get a blood test and we see that our inflammation markers are high, we need to do something about that. We can't just allow it to run free and be like, it's not a big deal, because that's a sign that something is not going well in our body. It's no different than having a check engine light on in your car. There's a sign. It's like you have to go do something about that. When my anxiety gets out of control, for the most part, I'm pretty much in control of my anxiety. But if I allow myself to, like, if I don't take care of myself and I allow things to build up and I'm falling into a really bad lifestyle, then my anxiety will take over. And then I can be like, okay, I got to get back to the root. What's causing all of this? Why am I feeling more reactive? Why am I more irritable? Why am I getting more stuck? It's a matter of like, so for me, what I really want to talk about all of that is pay attention to what's happening. What's your body trying to communicate with you? And then work towards healing your body. Work towards helping your body heal. Work towards loving your body and loving your brain so that your body is functioning optimally and making you feel good in the process.
And so that leads us into lifestyle. What do you recommend then? How to improve the lifestyle to be less reactive, because now you've made your body healthier?
Well, I think when we focus on taking care of our body, I mean, I don't know why society has taught us to be so mean and so hurtful to ourselves. Our negative self-talk is constantly going, especially if you have OCD or if you have anxiety. You have this constant chatter in your head that's beating you down, that making you feel bad about yourself. You're not good enough. Who are you to do this? You're never going to make it. You're awful at this. You're that. Never saying anything nice to ourselves. So starting with changing our negative self-talk, and paying attention to that. The reason I use this little guy, and I hate the fact that his little eye just fell off, but the reason I focus on this guy, it's a lot easier to talk to him and say nice things to him than it is to ourselves. So when I can say, you are capable, you are successful, you're a really good person, you can do this, you have the ability. It's like me talking to a little toddler, right? If I have a little toddler that I'm trying to teach how to write, if I'm constantly yelling at that toddler and saying, you're no good, you can't even write, look at the way you're holding that pencil, you're never going to make it, you're never going to be able to write. That poor kid is never going to be able to do anything, right? It's going to start internalizing that belief and start believing that I'm not able to write, and I'm probably never learn how to write. But if I'm encouraging and loving and supportive, then of course they're going to try and make it until they can learn how to write, right? It's the same thing with ourselves. We need to learn to change our self-talk. But first, we need to also not only to talk nicely to him, but also we need to understand what is the automatic script that he starts spewing the minute we're overwhelmed and stressed. So the best way to do that is to start journaling and catching those thoughts. So if I'm constantly telling myself, you're no good, you're terrible, you can't do this, blah, 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 whatever, then the more I start writing that down, the more I'm understanding what the language is. And that's when I can start changing the language. Then I can start changing that script that automatically kicks in whenever I'm overwhelmed, whenever I'm stressed. Obviously, taking care of our brain by the foods that we eat, making sure we're eating foods that are nourishing and healthy for our mind and our body is super important, and making sure that we're getting enough rest. So many of us are doom scrolling late at night. So many of us are glued to our phones. And the minute we wake up to go to the bathroom in the middle of the night, we come back in. And if we don't fall asleep right away, which isn't good anyway, we shouldn't be falling asleep right away, because that means our bodies are really tired and we're sleep deprived. But if we're not falling asleep right away, we're like, oh, then I guess I'm just going to get on my phone. And that just deprives you from actually getting the rest that you need and resting your mind and your body. Because in the middle of the night, when your body is in that deep, deep state of rest, your brain is literally getting washed. You're getting rid of all this clutter. And also, you talked about Alzheimer's. A lot of people with Alzheimer's have all of these plaque built up, right? And that plaque built up can be reduced significantly if we give ourselves enough time to rest, because it's getting washed. All that clutter gets rid of our body, gets taken out of our body, but we don't give ourselves that opportunity. We don't give our body a chance to heal and rest and repair. We're just doing, and then wondering, why am I sick? Why is my body inflamed? Why can't I sleep? Why am I gaining weight? Why do I not have energy? We're beating ourselves up and then wondering why we're not functioning the way we're supposed to.
And I hear so many people say, well, I'm so busy, that's why I'm forgetting everything. Well, yeah, you are forgetting things because you're so busy, because you're not looking after yourself. And it's not natural. It's not, it's not part of getting older. It's a function of the lifestyle that you created. Sleep is so, and it seems that in the last 3 or 4 years, I have many more clients just overwhelmed with the fact that they can't sleep. Like, that's the first thing we have right after sugar. After we get rid of sugar, then we talk about sleep.
Yeah, I joke that I'm very religious about sleep. I'm almost like almost militant about my sleep schedule, and that I have to get, and it's just a matter of our bodies are we're aligned and synced with the rising and the setting of the sun. So we need to be asleep when it's dark, and we need to be awake when it's light. So for me, the peak hours that I've identified based on, I used to wear the Oura ring, and it would tell me when my optimal time for sleep was between 10 p.m. and 2 a.m. is ideal for most of us. That's just a general range, but if we can make it into that range, that's when our body goes into that deep, deep level of sleep, and we get the longest level of deep sleep. A lot of people are so focused on the REM sleep, the sleep that they get when they're dreaming, but that happens more close to morning when we're waking up. We need the deep coma-like sleep in order to allow our body to completely rest and reset. And so we need to go into that sleep, but a lot of people are taking medications to go to sleep. A lot of people are drinking alcohol before they go to sleep. A lot of people are eating really late, and they're wondering why they're not getting enough sleep. A lot of people are going and filled with so much anxiety, drinking so much caffeine that their cortisol levels are through the roof. So by the time they lay down to get to sleep and lay down to fall asleep in bed, all of a sudden that anxiety comes up because they haven't given themselves the chance to really process all of those emotions. So then that's keeping them awake. So our sleep hygiene needs to start in the morning. We need to figure out what we're drinking in the morning, getting outside, getting enough light, resetting that internal clock, making sure we're eating at the right times, making sure we're not having too much caffeine and too much sugar that's keeping us awake, and then creating an optimal bedtime routine so that we can fall asleep and get that rest and repair.
Yeah. So not just jumping from, oh, you got home from the office, or like me, I work at home, so I walk from here to the bedroom. Basically, that's not a good idea. You need to have that downtime to decompress.
For me, I'm just like, even if I read 1 to 2 pages of an actual physical book, helps me. That's part of my transition. I might not have time to read a chapter. If I read 1 to 2 pages, if I can write in my journal, if you're not able to sleep, let's say you normally go to bed at 12 o'clock, but you want to go to bed at 10. If your normal bedtime is at 12, you're not going to be able to go to 10 and just fall asleep like that, because your body has an internal clock. It's going to start feeling sleepy around 11:30 for you. So you have to train your body slowly by 15 to 30 minutes at a time, slowly getting back to that 10, and train your body for 10 o'clock instead of just flip-flopping with one day you're going to bed at 12, the next minute you're going to bed at 10, the next one at 3 in the morning. It's just that completely creates chaos in your sleep routine.
I often wonder about people who do shift work. I don't know how they do it. Like, it would be really hard for me because they'll go for like 6 days of 8 to 4 and then 4 to 12. That must mess with their sleep system so much.
Well, the World Health Organization actually considers that a carcinogen. It's a cancer-causing behavior because our bodies are not meant to be awake in the middle of the night. And this is why a lot of people end up having high blood pressure, heart issues, digestive issues, because you might be sleeping. People are so focused on the number of hours that they're getting. I'm not worried about that. I'm worried about when you're going to sleep. I would rather you get up at 3 in the morning and start work than to work throughout the night and then go to bed at 6 in the morning, because you need to have that deep level of sleep, like I said, between 10 and 2. Obviously, getting that REM sleep is important too, because that's when we're editing our daily activities, and that's where we're creating our long-term and short-term memories, and we're getting rid of a lot of things that we don't need. So dreaming is also important, but the deep sleep is what's really, really necessary, and we can get that mostly, the majority of it, in the middle of that night between 10 and 2.
Now, a lot of people are suffering panic attacks. I used to suffer them when I lived in Las Vegas, and I was convinced it was the electromagnetic forces around there. But a lot of people do suffer them. How do you stop them? You've got that as a question here, and I think many people would love to know.
So panic attacks, they don't hurt you, although 70%, they say 70% of emergency room visits are related to panic attacks, because people, when they're feeling it, it's such an overwhelming feeling that you feel like you're having a heart attack and you're going to die. And of course, I mean, if you are having a heart attack, you should be going to the emergency room. But the majority of the time, for people that have an anxious predisposition or anxiety provoking thoughts, they need to understand the difference between a panic attack and a heart attack and understand those symptoms. Understanding that a panic attack is never going to hurt you, but the first one is so overwhelming that people almost have PTSD from the first one. So the next one, they freak out even more for the following subsequent ones. The best thing to do is obviously to be preventive, so that you're managing your anxiety enough, you're managing your thoughts, you're eating the foods that your body needs, you're taking the supplements that your body needs, you have all of your resources to help you feel more calm and balanced. But if you end up having a panic attack, the best thing to do is to take a deep breath and look around you and identify 5 things that you can see with your eyes and identify them. So lamp, book, whatever, identify them as you're taking deep breaths. And then I listen for 4 things that you can hear, and that could be the air conditioning, that could be the sound of your voice, that can be whatever. Identify 4 things you can hear, 3 different things that you can touch, 2 different things that you can taste. Smell, and then 1 different thing. I was wondering what's the other one. 2 different things that you can smell, 1 different thing that you can taste. And the taste can be even your saliva. But what that does is it grounds you back into your body. And it brings you back into this moment, because anxiety is very much future focused, right? You're panicking about something that could happen. But if you can take a deep breath and bring yourself back into your body, identify the things around you. Like I said, 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, 1 thing you can taste. Or you can just flip around those numbers, whatever works, but just bring yourself back in your body and activate your 5 senses again as you take a deep breath. Another thing you can do is do some tapping. Tapping is just tapping on different meridian points, and just kind of, as you're doing that, breathing, so that you're putting yourself back in your body. And within 90 seconds, usually to 3 minutes, the feeling of panic attack will go away. But if you allow it to continue, it can go on up to 30 minutes. But like I said, if you can sit with it and know that it's not going to hurt you, and all you need to do is calm yourself down. It's almost like giving this guy a hug, right? Just calming him down. It's okay. When we are around toddlers and they're having meltdowns and they're having a freak out, we will call it a tantrum. We call it a tantrum for a kid, right? But we call it panic attack for ourselves. If a kid is having a meltdown, we don't sit there and freak out with them. We hold them. We calm them down. We say nice things to them. We might give them some food. We might get up and go and distract them with something. All of those things we can do to ourselves. If we're feeling like a panic is kicking in, we can actually get up and go to the refrigerator and get some water, and that breaks that loop so that it doesn't continue. We're almost a little ADD, like the minute it's like squirrel, like if I'm in the middle of a panic attack and the phone rings, then I'm like, totally, I forget about my panic attack or like where I was. And so we just need to break that loop and go do something else and distract ourselves, or just sit and calm ourselves down.
Right. That's excellent. Yeah. Panic attack is not probably going to hurt you. I love that. Thank you. Now, you are having a conference in 2024. Please tell our listeners about that.
Yeah, so I've been doing this conference online since 2020. It's a mental health reset conference. We get together, we talk about natural ways to kind of balance out our mind and our body. And it's in January 2024 in Phoenix, Arizona. And it's for just resetting your year, getting 2024 off on the right foot. I have a lot of holistic and integrative people coming in to talk about different ways of balancing our hormones, using essential oils, making the connection between our oral health and our mental health, where we'll be doing a lot of just natural and holistic ways of feeling good overall. And I wanted to do it in person this year just because everybody's so sick of doing things online, and bring everybody together for 2 days of fun and just getting together.
It sounds awesome. I'm going to be sure to put a link to that in the show notes. Thank you so much. I think people will really like that. How else can people reach you to work with you?
Well, I'm available on all social media platforms. I'm on Facebook at Dr. Nafisa Sekandari, or I think it's Dr. Sekandari, I'm not sure. But on Instagram at Dr._Nafisa_Sekandari. You can always find me on transforminganxiety.com. I'm also on LinkedIn, and I have my podcast, Mental Health Break Podcast, which you can also see the video interviews on YouTube as well, on my YouTube channel.
Perfect. Thank you. I will make sure to have all of those links in the show notes. And I cannot thank you enough for sharing your wisdom with us and being so open about, not everybody's willing to talk about being anxious or having issues like that. So thank you for being so open and sharing and helping others get control of their anxiety.
Well, thank you so much for having this conversation with me.
Thank you so much for joining us for this episode of Brain Health Matters. I'm Kate Kunkel, and I hope that you've learned much about how to holistically deal with anxiety. I've included all of the contact information for Dr. Nafisa Sekandari in the show notes. And remember, there are many more episodes of Brain Health Matters, along with the latest brain health research on our website at brainhealthmatters.today. Thanks again for joining us. And until next time, remember, it's never too early to look after your brain, but it can become too late. Now is the time to start.